Hello, my name is LaQuinta Roberts. This course is for nurses who are proficient and are now transferring to the post-anesthesia area. Over here. Frequently used post-operative pain medications. This is a requirement for MN 524 Curriculum Design Assessment and Evaluation for Kaplan University. Controlling and minimizing pain is a high priority after airway assessment for the post-op nurse in post-anesthesia care unit. Communication plays an important role in assessing patients' post-operative pain when using pain rating tools. The Stanford Pain Assessment Tool is used for patients who are able to verbalize. As you can see, 1 to 3 is mild pain, 4 to 6 is moderate, and 7 to 8 is severe. Good comprehension of pharmacodynamics of pain medication is principal for the PACU nurse. The numerical rating scale tool is widely used and has good sensitivity, and it generates data that can be statistically analyzed for audit purposes. Capnography. Capnography measures ventilation, not the patient respirations. This is another good tool used in PACU to assess the patient's status. The first indicator we use is capnography for impending respiratory depressions. We do not rely on pulse ox anymore. The normal values for the end-tidal CO2 is 35 to 45 millimeters of mercury. As you can see, the capnography waveform patterns normal is around 45, but when we begin to get hypoventilation or oversedation, they go above 45. And this is when we'll alert the nurse to know that we are oversedating the patient. Remember, just because the patient chest is rising do not mean he is getting adequate ventilation. Antiemetics and analgesics are our first lines of medications for the post-operative patient. Analgesics act on the peripheral and central nervous system to relieve pain, and they are usually the first medication on the pain ladder. The effects are usually from 2 to 4 hours, and they're usually given with opioids or narcotics, if not affected alone. Oframed 1000 IV is given over 15 minutes times 1. And we are to exercise caution in hepatic patients. Side effects to analgesics are nausea, vomiting, abdominal pain. Benzodiazepines are usually given preoperatively because it produces sedation and amnesia, but post-operatively it's good for treating delirium and agitation. It's a psychoactive drug, and it's Ativan and Valium are some examples in Versed. Their side effects are extreme sedation, and yes, we have to be cautious using benzodiazepines in the elderly. Usually the dosage is decreased. Reversal agents. Narcan. Narcan is for narcotics and opioid reversals. Side effects are high blood pressure, cardiac arrhythmias, and agitation. We have to remember that reversals are only given in emergent situations, like respiratory depression and excessive sedation. Narcan is given in small increments, and we can repeat every 3 to 5 minutes till patient is reversed. You can see it's given 0.1 to 0.2 milligrams IV doses. Onset of action is 1 to 2 minutes, and repeat every 3 to 5 minutes till patient is awake. Opioids is the very popular and very, very effective pain medication we use in PACU. Opioids bind to the opioid receptors in the brain and block and mimics our natural neurotransmitters and stimulates the nerve cells. It floods the brain reward system of dopamine and create that euphoria. Morphine and dilaudid fentanyl, those examples of opioids. They're also given in small increments, 0.5 IV Q5 minutes times 4 doses, or until the patient is relieved of pain. But remember that these medications are given in smaller doses as the maximum amount is reached. And capnography is always indicated after these patients take these strong drugs. Respiratory depression is a side effect, drowsiness, nausea, vomiting, itching. Some people have a lot of itching. We have to do a patient education, let them know that this is a side effect of the medication. Sometimes they have to add a little Benadryl also. Reversal agents. Reversal agents are for example, Narcan. Side effects are high blood pressure, cardiac arrhythmia, agitation. We just spoke about these. Let's see. Opioids, anesthetics. Anesthetics are used to prevent pain during surgery. Anesthetics causes a reversible loss of consciousness. General anesthesia, which are usually in the form of gases. Some examples are isoflurane, cephaloflurane, desiflurane, are given IV. The side effects are coughing and oversedation, of course, laryngeal spasms, especially in asthmatics. So when these patients come out, we are assessing them right off the bat for excessive sedation or unconsciousness. Local anesthesia is also given in the OR. Local anesthesia renders the reversible loss of sensation for a specific area during surgery. An example is ketamine. Ketamine is an anesthesia and it is a powerful pain medication. Usually the patient is comfortable after coming to the PACU after receiving ketamine. But Brevitol and thiopental, propofol, all these medications, the patient will still need pain medications when they get to the PACU. And some of the side effects are delirium upon awakening and illusions. We're to avoid propofol in people with allergies, egg allergies. Now we get to the blocks. The neuromuscular blocks works at the neuromuscular junction to generate an action potential by binding with acetylcholine receptors. These block the signals between the nerves and the muscles, actually rendering the patient paralyzed. Nimbex and Roconium are examples of these medications. Itching, flushing, lightheadedness are some of the side effects you may see in these patients. With these medications, we like nerve blocks and epidural blocks. Patient education is very important because the patient comes out, especially with the epidural blocks, complaining that they can't move their legs. We have to remind them that within 1 to 2 hours with the epidural block, yes, they will be able to move and sensation will eventually come back slowly. Anxiety, pain locally, and headaches and facial flushing are some of the side effects. Capnography monitoring is indicated with these patients also if they're going to the wards. And that concludes my presentation. We have to remember airway and then pain medication is always a priority too with PACU nursing. And thank you for your attention and thank you for listening. This is La Cuenta. Bye.